My name is Paula Fedyk, and I'm from Colorado. Here's part of my story. It's Christmas Eve, a loud crash, bright lights, my husband unconscious. Trapped in the car, time goes by slowly. They tell me a drunk driver hit us. My arm and head hurt. 45 minutes. What's taking so long? Focus on prayer. In the ER, I wait to be examined and ask how he's doing. He isn't doing well. But he can't die, he's only 33. And he has kids. I sign out against medical advice and watch as 12 people work on him to save his life. He's thrashing, bleeding, and his leg is obviously broken. They work swiftly and focus on stabilizing him. My head's throbbing. I can't cry. I hope I'm okay. Christmas morning, he is stable in a coma. Our 4 children spend the holiday without us. Gifts remain under the tree. Can't sleep, can't eat, and my heart struck with grief. Days later, he emerges from his coma, eating, talking, and almost walking. But his brain is injured. They compare it to shaken baby syndrome. They don't know if he will improve or decline. Every brain's different. He's a fall risk. He's going to need 24/7 care. He doesn't qualify for skilled nursing. Who will be the caregiver? Me. First, I shut down our website, which was our labor of love, and then leave my job and lose my health benefits. I miss my grandma's funeral and my brother's wedding. Travel not an option. I allow our teenagers to live unsupervised. We need to be close to treatment. I cut our costs and apply for help. I give up my hobbies. I don't have energy for my friends. I have no time alone. I learn about every available therapy and get every consult we can afford. I question my sanity and fight for endurance. Eventually, I manage to find some stability within the chaos. 3 years later, I'm waiting for my son to pick me up at the airport. An unknown caller tells me to meet my son at the hospital. I go there quickly. He was in a wreck. The police tell me it's a miracle he survived. He's conscious but not himself. He has a traumatic brain injury. Unbelievable. His symptoms get worse slowly over time. He has to be put in an assisted living home. He doesn't want to burden me. It takes too long to find a home for him. He chooses to be homeless. It's winter in Colorado. All I can do is pray. One day he comes home and asks to go to the hospital. He gets admitted to the psych hospital. After 2 days, they say it's not a good place for brain injury. They leave it to me to find an assisted living home. I find one. He lives there 3 months. Then they're unable to accommodate his symptoms. He returns home, enrolls in college, and finds a job. The symptoms continue to haunt him and worsen. He goes to the crisis center often. He needs relief. He's suffering. He starts using drugs. I find a rehab center where brain injury is accepted. We have to drive 2 states, and we need $30,000. I mortgage our home. Still no income. On day 3, the treatment center calls to tell me they can't accommodate his brain symptoms, so they discharge him and tell me he's on the streets without his belongings. It's winter in Montana. He hitchhikes to the police station where they allow him to call me. Back home, his symptoms continue. I'm monitoring him all the time now, staying up all night, worried. Doctors, therapy, yoga, massage. He needs to see a psychiatrist, but I can't find one who takes Medicaid. The waiting lists are 3 months long. It doesn't matter unless he's suicidal. I don't know if he is, but I think I might be. Nothing's wrong with me. Why do I feel like leaving it all? Why do I need relief? I'm not injured. 2 survivors, I should feel grateful. Guilt, shame. Why do I want to die? Selfish. I find out it's $400 to visit the psych doctor. My son visits her. She prescribes medicine. His symptoms change but do not improve. She needs to see him again, $400. New meds. He collapses while working out. We race to the ER and he is admitted. A week later, he leaves the hospital with a new diagnosis, schizophrenia. Unaided, I figure out how to navigate public resources for him. He stabilizes and commits to wellness. He learns to cope with the symptoms. We know it's forever. I learned to manage my new responsibilities. It's never perfect. And the caregiver effect is magnetic. It's a rare skill set, refined by time and experience. And when others need help, they call. So what have I learned? Compassion is sacred, and fate is an excellent teacher. Caregivers sacrifice their health and well-being volunteering within a system that does not support them. And caregiving immunity does not exist. You will be one, need one, hire one, or supervise one. Thank you.